usually, most of the people, breast is a very sensitive part. That's what we all think about it. Actually, it is a very sensitive part because there are a lot of nerve endings there. So, for this reason, a lot of people have apprehensive about the pain for the breast augmentation. I know a lot of people who withhold the procedure only for the reason that it's a painful. But the fact is, this is first of all, it's totally done under general anesthesia. During procedure, client or patient will never realize what is happening. And with the ongoing, whatever the nerve blocks and long anesthesias we are giving, first 24 hours to 48 hours, patient doesn't feel anything. So it's, you can say almost literally a painless procedure. What they actually feel is a soreness. There's no sharp pain, a stabbing pain, or extreme excruciating pain. So these things will never exist in breast augmentation. Because of the expansion of the breast tissue, they feel little uncomfort, discomfort, and soreness, which is usually going to last for 5 to 7 days. After that, body body adapts to the situation, and we usually manage this situation with simple painkillers for a morning or once or twice daily, which is usually written for 5 to 7 days. If people who are really sensitive, we extend the painkillers for up to 10 days. But otherwise, if you ask me, it is a quite easy, a simple procedure with a very minimal pain. So I can say it's actually, we can't say pain, it's a discomfort, I can say. But for the self-image benefit what they are getting, it is something worthy, you can take it. Implant, now what we are doing today's world is the liquid silicone gel implants. Earlier people used to use, I mean, at least in the past 20-30 years, there's a lot of improvisation has come. People used to use saline implants or silicone liquid implants. It is current ones cohesive silicone gel implants. It is quite a thick gel which actually feels exactly like a breast. So when it goes inside the body, breast tissue and implant doesn't have any difference. So they exactly feel the same. For the patient, they can actually sense whether they can actually palpate and feel. They can actually, person-wise, they can feel its difference between implant and pressure and original tissue. But their partners may not actually feel which is implant and which is fingers. It is exactly feel the same as a normal breast with the current technology what we have. There's something called inframammary crease. So every breast in the body has a natural groove, natural crease, which is associated with the chest. So that is the reason breast is able to move on the chest freely, and the line is fixed line. So whenever we do implants, we try to use this line as a incision so that even after healing, it looks like a natural line which is already there. So I can say this is almost invisible. I don't say it's a scarless. Even there is a scar, it is a totally invisible. After 6 months, people don't even know where they cut the tissue. So it is actually, if you ask me, it is a very, very lean, thin, simple scar, which you don't need to worry about any scars. It always depends on the whom you are getting it done. So there are people who doesn't have a knowledge about it, they still do it. And it's just not a pushing in the implant inside the body. It is the experience of surgeon which matters, and the quality of implants, which is very, very vital. So here at our Redefine, we use only FDA approved implants, which are usually a little expensive. So there are other side, there are Korean and Chinese implants, which are actually available for the much cheaper prices. But the efficacy, the stability of implants is not guaranteed. Since it's a lifetime procedure, I would always recommend to go to a qualified, a board certified surgeon and ask for the FDA approved implants. Usually most of the surgeons generally won't take a risk of using unbranded Chinese implant because there's no label there. So they can last for 5 years, they can last for 10 years, and it's inside the body. So I generally don't recommend to go for unapproved, non-FDA approved implants. So when you are going through these two factors, the price usually going to be a little higher compared to the people who are using a generic implants.